I think as a qualified nurse you need to get a ground and you need to start small but then start looking at all the diverse opportunities. You could work in a prison service, you could work in a hospital. There's some of my colleagues work in maternity services and health visiting, all sorts of things out, all sorts of roles.
I'm a learning disability sexual health specialist nurse based at the New Croft Centre in Newcastle.
I work for Tees Esk and Wear Valleys NHS Trust as a community team lead.
I'm a community clinical manager for people with learning disabilities and also older adults in mental health services.
And I'm primary care liaison nurse and that's in County Durham.
I'm a learning disability community nurse working in Cumbria, and I also support the strategic development of health services for people with learning disabilities in Cumbria.
For the past 12 years I've worked in a role as a clinical nurse specialist in Macmillan Post.
So I do things like joint clinics with GPs, so me and the GP will do annual health checks with people with learning disabilities, and I work with the nurse practitioners and things as well.
The whole variety really, a lot of educational work, so we do the clinic, and then I tend to do a lot of training as well with staff and training myself in terms of the sexual health elements of my jobs.
The students come here for 3 years. They spend 50% of their time in practice, working as a student nurse, and then 50% of their time here. So it's a pretty intensive course because at the end of it, they don't just come out with a degree, they also come out with a registration for being a learning disability nurse. So 2 qualifications are going on simultaneously.
The course has really taught me a lot about how to care for people with learning disabilities. It taught me to not only just support them, but to look beyond their needs and be there and be an advocate for them. It also taught me about inequalities that people with learning disabilities face, in which sadly some of them are dehumanised, so they have a label that should not be there, and it's important that we overcome that stigma to make sure that in the future people with learning disabilities can receive the care and the respect that everyone is entitled to.
It benefits me knowing that there's somebody coming and they're like looking out for us, like they care about us, like care about me health and me welfare and that. And the more help you get, the better it is for you in life.
And I think as a learning disability nurse, the scope of, if your practice allows you to, almost be quite creative in terms of what job you go for, because there's people with learning disabilities everywhere, people in all walks of life, and across the health service we need specialism to be able to meet those individual needs.
You see there's more interest now from other fields in learning disability nurses going and working within there. The recognition that the skills that you build as a learning disability nurse are transferable into mental health nursing, into children and young people nursing, into working with older people with things like dementia or stroke.
There's so much opportunity. I mean, like myself here, I've landed a job that I wanted because I was here as a management student. I knew exactly what I wanted, and I was able to get all of the experiences I needed so I could take that into my interview.
We have to persuade other professionals, for example, about the rights of people with learning disabilities, so we have to be quite assertive as well. So a learning disability nurse has to be somebody who's very creative, who is willing to stand up for the rights of others.
It's not always easy, but actually I think a lot of people kind of appreciate your own unique insight.
When somebody has a life-limiting, life-threatening diagnosis, you only get one chance to get it right for the person and the people who are involved in supporting that person and their families as well.
I think that the best part of the role is when you get that phone call from a delighted parent that's kind of said thank you for your involvement, it really made a difference.
I think probably because of the inequality that people face and feeling that the job satisfaction comes from being able to actually look at and see you're helping someone to improve their lives and well-being.
I think it's a vast career path. I think there's just so many branches to it. There's so many ways you can go. There's so many places that we're kind of, it's like Inception now. There's lots of different learning disability nurses in all areas, and it's great.
The course opened my eyes up and showed that there's a lot of discrimination. People with learning disabilities don't often have a fair deal in our society, and that really the learning disability nurse helps to make people's lives much better. That's one thing I learned more than anything.
The job of the learning disability nurse is amazing. It's a different job every day. Every day that I do this job I learn more and more. I meet some incredible people with an awful lot of challenges to deal with, but people who want to overcome those challenges, and by us offering a little bit of support at the right place at the right time, we can make a difference, and that is the most amazing feeling, to go home at night knowing that you've made a difference.
I think I would say go for it. The sky's the limit in learning disability nursing. The sky's the limit in learning disability nursing alone.